According to health authorities, the number of COVID-19 cases in the Ashanti region keeps increasing, and as a result, treatment centers are getting full. According to management of the Komfo Teaching Hospital, the only facility which takes care of critical cases of COVID-19 in the region, it is getting stretched out and has thus called for the need to set up an infectious disease center in the region, specifically designed to take care of diseases such as COVID-19 within this pandemic era.
Well, I think clearly speaking, as a region and it's even as a belt, as I would call it, we are serving not just Ashanti region, but referrals coming from over 12, 13 regions or the current 16 regions we have in the country. All because of the specialty that we have here, the equipment we have here, and what have you. So I think the replica of an infectious disease center, as has been done at the Ghana East Hospital, is what we need to be replicated in Komfo in Kumasi to serve our interests. And I think also to some extent somewhere in the north.
Aside the issue of treatment centers, another issue residents want addressed is the turnaround time for COVID-19 results to be ready. While some say their results took a very long time to be ready, others say they did not even receive any information concerning their results. Ezekiel Mensah is one of the disturbed persons.
I had the test and they took the samples of everything that's supposed to happen. So they took it home and they took it to whatever they want to take it to, and I was expecting, the feedback with some few weeks time, but I took time to wait for them, and then there was nothing like that happening. So I realized maybe I have it or I don't have it. So that was what was going in my mind like that. So on top of that, I went ahead and go to my business because there's nothing I can do to keep awake my business. I would love everybody to get feedback. You can't get into a test and not respond. You wouldn't know your status in the first place.
The Ashanti region now has 3 main testing centers: the Kumasi Center for Collaborative Research, KCCR, the Public Health Reference Lab at Kumasi South Hospital, and the Komfo Teaching Hospital. The Ghana Health Service says, on the average, the Ashanti region records 150 new cases anytime the testing results are released. Although some residents in the region who spoke to Citi News said their test results took a while for them to know either they are negative or positive, and that could potentially put them and other people at risk, the Ghana Health Service says testing centers in the region have been expanded to ensure many samples are tested in a day. The Ashanti Regional Health Directorate reiterates that persons who are being referred from various facilities and those identified as part of contact tracing are not supposed to pay any fee. It however says travelers who walk into any of the 3 testing centers would be charged. Speaking to Citi News, the Deputy Ashanti Regional Director of Health Services in charge of clinical care, Dr. Rita Larson-Reindorf, cautioned travelers not to deal with Ghana health institutions but should only deal with the 3 diagnosis centers, as they are the only ones that have been mandated to do that.
Another thing I would want to caution the public is that for travelers can have walk-in testing done for them at these 3 places that I have mentioned, which is KCCR on KNUST campus, the Public Health Reference Lab at Kumasi South Hospital, and Komfo Teaching Hospital. So for travelers, they should not engage anybody in any of our facilities, the Ghana Health Service facilities, who says that I'm testing for travelers. It may be a scam, because we've received reports of travelers being engaged in people approach them in our hospitals and say that, oh, we can test for you if you are traveling, and they charge them.
On the issue of some frontline health workers who the Ashanti Regional Branch of the Ghana Registered Nurses and Midwives Association says has still not received their benefits, Dr. Larson-Reindorf says the matter is being addressed as some of them received theirs in January.